Prime Minister is preparing to reveal his roadmap out of lockdown on Monday. We're all eagerly awaiting to see what it will be. He says, though, there will be a cautious easing of restrictions.
Yeah, Boris Johnson has also admitted that he cannot guarantee that this will be England's last national lockdown. Joining us now is the Vaccines Minister, Nadhim Zahawi. Thank you for joining us this morning, Nadhim Zahawi. Hopefully you heard the family of our last guests, who was a nurse that had worked on the front line, refused not to go out to work even though she was advised not to, and sadly contracted coronavirus and has passed away. Her children all still working, apart from one of them in the NHS, and her legacy is living on. You yourself have been touched personally by coronavirus. You revealed on our show that you had lost your uncle. It's an ongoing challenge, isn't it, for people who are feeling like we are very tired and this COVID fatigue has set in, and yet understanding that the dedication and the commitment from some just extraordinary heroes on the front line can never be underestimated.
Totally, and I caught the end of that with Angelica and Gerard, and I guess the one overwhelming emotion is to feel that, you know, if we can do more than the 7 days a week, 19-hour days that the whole team is working on the vaccination programs, then we will, as part of that remembrance of their mum. And of course, many people have lost loved ones, my uncle and others, of course. And what I want to do is make sure that we continue to protect people with the first dose. So we're now focusing on 5, 6, 7, 8 and 9 in the first phase. That is the over 65s, and now 6, which is 16 to 65-year-olds with underlying health conditions, and then all the way down to the over 50s by end of April. So that's 32 million people who have the first dose, or of course, the second dose. This week, for the first time, we've got out the information to GPs and to hospital hubs, the amount of vaccine they're going to get to plan for the next 3 weeks of second dosing, and of course the first dose as well. So it just makes me want to just, you know, redouble our efforts to vaccinate as quickly as possible and protect more people as fast as we can with the vaccines.
Can we talk a little bit about that? Because I know that you were on one of our colleague and friends, Ian Dale's show, talking about vaccines, and there was some confusion over the position of people who have asthma. Let's just remind our viewers, in case they missed it, of what you said on Ian's show.
If you're classed as an asthmatic, if you have an inhaler, is that enough to put you in group 6? Or, as Adam says, do you actually have to have a more serious side to it?
No, if you have to have an inhaler and you are asthmatic, then you are in group 6.
But that's not the case, as far as I understand, is it? It's the clarification of group 6 is actually if you're having oral medication, if you've been hospitalised. And I suppose we know we've had a huge response from people this morning, very concerned.
Yeah.
Should they be getting it? Should they not be getting it? The confusion adds to the anxiety of a group of people that are already very anxious because they're vulnerable and many of them shielding. How did you get that wrong?
You're absolutely right. So in category 4, those with serious, extremely vulnerable cases of asthmatics would have been given the first dose in category 4. And now in category 6, if they have oral steroids, then they are in category 6. The Joint Committee on Vaccination and Immunisation looked at the evidence, and that's what we are guided by. And I apologise if there is any confusion. I certainly don't want to have any confusion at all. But they are the categories within group 6, which is 16 to 64-year-olds with underlying health conditions, respiratory health conditions, one of them, but of course heart conditions, diabetes, and others. And it also includes those who are carers, unpaid carers, for those who are critically extremely vulnerable or the elderly.
So, look, when we get to the end of April, as you say, the over 50s hopefully will have been vaccinated, and all indications are pointing to that happening. What is the plan there? Where are you going to look to try and get the next tranche of people vaccinated? There's a lot of sort of suggestion that perhaps that could be teachers, it could be the police, it could be those frontline workers that haven't had an opportunity but are working face-to-face with the general public. What is the thought there and the strategy?
So we've gone back to the Joint Committee on Vaccination and Immunisation to ask exactly those questions, to ask them to look at, obviously in the context of serious infection, hospitalisation and death, to look at professions, teachers, police officers, prison wardens, of course, those who work in supermarkets, so shop workers as well. And if that should be our focus, because they come into much greater contact with people and therefore much greater volume of the virus. And they will look at all the evidence and will advise us in the coming weeks on phase 2. And then we will follow that advice to deliver phase 2. And then ultimately, as Simon Stevens, the chief executive of the NHS, described yesterday, this is a series of sprints. So we've done one sprint. We're now in sprint 2 to get to the end of April. It's about 32 million people, and then a big marathon, which is a possibility of a winter booster jab, and then, of course, ultimately maybe next year an annual COVID vaccination program. So we want to make sure at the moment we focus on delivering to the adult population the vaccination program. We have one of the highest positivity ratings in the world. I think the Ipsos Mori survey had us at 89% of adults saying they are very likely or most likely to take the vaccine. That is our focus. So phase 1, phase 2, and then all adults. And we will look at, of course, making it even more convenient, having it delivered through the great both community and independent pharmacy networks in the UK.
Do you have an instinct? You've been lauded personally for delivering this. We all look at the vaccination programme and think, thank goodness, after so many things, so many attempts at various strategies haven't worked out, this seems to be going well, thank goodness. Do you have an instinct about whether some kind of vaccination passport to be used to travel abroad, or indeed to get back into life here in the UK would be a good idea? It's been suggested it might be helpful in the opening up of pubs and hospitality, that people can prove they've had the vaccine. Do you have an instinct about that?
Well, Kate, first of all, I feel like an imposter because I stand on the shoulders of the real heroes, which is our NHS family, the doctors, nurses, pharmacists, the military, and of course the thousands of vaccinated volunteers and the hundreds of thousands of marshals and stewards. This is the best of the United Kingdom coming together to make this deployment such a success. And of course, the scientists and the manufacturers for delivering the vaccines to us. So
we won't give you all the credit. We know they're good too. We know they're good too. We've lauded them as well. But do you have
I sometimes feel like an imposter in many ways. But your question is a really good one. So some countries are beginning to move in the direction of requiring a certificate in the way we do now in terms of pre-departure testing. And as other countries do, you have to have a pre-departure test and a certificate. So some countries are looking at only allowing people in if they have a vaccine certificate, and we will look at to facilitate it for the individual. So for your viewers who would need that certificate in the way they would have needed a yellow fever vaccine certificate to travel to particular parts of the world, then we'll make that available. We are not looking at a vaccine passport for our domestic economy. I think it's much better to vaccinate the whole of the adult population, offer the vaccine to them as quickly as possible by September. And linked to that is our testing program, both in terms of surge testing, rapid testing and isolation, but also the lateral flow test and the rapid test. We now in Parliament have to be tested twice a week. The NHS have been doing the front line for many, many weeks and months now. Obviously, social care have been doing that in residential social care.
Hard to see how that work in a pub context. So I have to have it when I've quite a lot of contact with the NHS at the moment because of personal circumstances. You know, you have to wait for a period of time, 15, 20 minutes. You have to be in a room isolated. I'm just imagining as people arrive at the pub how that will be practical to manage. And for some people, the argument is if you have a passport, it makes it easier to get back into cinemas and theatres and all of that.
Well, several problems with that. One, we don't yet know whether the vaccines have an impact on transmission, and therefore you may be getting a false sense of security. Two, we're not looking at a vaccine passport for the domestic economy. We're looking to facilitate it for an individual if they need to travel. And three, the best way is to vaccinate the adult population as fast as we can. And there's new technologies in rapid testing that are constantly coming forward and being tested by our scientists at Porton Down, where it does allow you speedy, testing to be able to open some of those venues. But it's a combination of all those things. I don't think there's going to be a single sort of silver bullet that will resolve this. But the most important bit I know is to make sure that the vaccination program, because vaccines work. They're saving 2 to 3 million people a year from other diseases, and we know they work on COVID. So the important thing for your viewers is when you get your turn, please come forward and get your vaccine. It's good for you, keeps you safe, good for your family, and good for your community.